Hi everyone, welcome back to my YouTube channel, and today we are going to talk about temporomandibular joint. So let's start our topic with introduction. Temporomandibular joint is a specialized synovial joint that connects the mandible to the temporal bone of the skull. It is one of the most complex joints in the body, allowing both hinge and gliding movement, which make it a ganglionoarthroidal joint. TMJ plays a vital role in chewing, swallowing, speaking, and facial expression. Location of temporomandibular joint. TMJ is located anterior to the external acoustic meatus between the condylar process of mandible and mandibular fossa of temporal bone. Articulating surfaces of temporomandibular joint. First surface is mandibular fossa or temporal bone, that is a concave depression in temporal bone that accommodates the condyle of mandible. Second is articular tubercle of temporal bone, that is a bony prominence in the front of mandibular fossa that prevent anterior displacement of the mandible. Second articulating surface of the TMJ is head of mandibular condyle, that is rounded structure at the superior end of mandible that fits into the mandibular fossa. The articulating surfaces are covered with fibrocartilage, not by hyaline cartilage, making the TMJ unique among synovial joints. Articular disc in the TMJ. This is a fibrocartilaginous disc that divides the TMJ cavity into two separate synovial compartments. First is upper compartment that allow transitional movement or gliding movement, and second is lower compartment that allow rotational movements or hinge movements. The disc in this between them is biconcave and is attached to the capsule and condyle, but is not directly attached to the temporal bone anteriorly. Posteriorly, it attached to retrodiscal tissue, that is a vascularized and innervative connective tissue. Joint capsule. It is a loose fibrous capsule that surrounds the joint. It attaches superiorly to the articular tubercle and rim of mandibular fossa, and inferiorly it attaches to the neck of the mandible. Capsule is reinforced by ligaments. Ligaments of temporomandibular joint. First, there are intrinsic ligaments that include lateral temporomandibular ligament that strengthen the capsule laterally and prevent posterior and inferior displacement of the mandible. Then there are extrinsic ligaments that include spinomandibular ligament that runs from the spinosphinite bone to the lingula of mandible, and stylomandibular ligament that extend from the styloid process to the angle of mandible. These ligaments provide additional supports and limit extreme movements of the mandible. Movements of temporomandibular joint. TMJ allows the combination of hinge and gliding movement for mastication and speech. They include depression, that is opening of the mouth. In this, there is initial hinge movement that occurs in lower compartment. Then there is gliding movement of condyle and disc that occur in upper compartment. Second movement of temporomandible is elevation, that is closing of mouth. Third movement is protrusion, that is forward movement of the mandible. And fourth movement is retrusion, that is backward movement of the mandible. Then there is another movement of mandible that is called as lateral movements or side to side movements, and these are important for grinding foods. Muscle acting on temporomandibular joint. First we will talk about muscles that act on temporomandibular joint while depressing of the mandible. They include lateral pterygoid muscle and digastric muscle. Anterior belly, mylohyoid and genohyoid muscle assist in depression of mandible. Second are the muscles that act when elevation of mandible. They include masseter muscle, temporalis muscle, medial pterygoid muscle. Third is during protrusion of mandible. The main muscle that helps during protrusion of mandible is lateral pterygoid muscle, and the muscle that assists in protrusion of mandible is medial pterygoid muscle. Muscle that act on TMJ during retrusion of mandible include posterior fibers of temporalis, and digastric and genohyoid muscle assist in retrusion of mandible. Then there are muscles that act on TMJ during lateral movements. They include alternating contraction of medial and lateral pterygoid muscles on one side. Nerve supply of TMJ or temporomandibular joint. TMJ is innervated by auriculotemporal nerve, that is branch of mandibular division of trigeminal nerve, that is fifth cranial nerve. It is also supplied by masseter nerve, that is also branch of mandibular division of trigeminal nerve. It is also supplied by deep temporal nerve. Blood supply of temporomandibular joint. It is supplied by superficial temporal artery, deep auricular artery, ascending pharyngeal artery, and maxillary artery. Clinical significance of temporomandibular joint. First is temporomandibular joint disorders or TMJs that are characterized by pain, clicking, or restricted jaw movements. Common causes for TMJ disorders include disc displacement, arthritis, stress-induced clenching, or trauma. Second significance is dislocation, that is, the mandibular condyle move anteriorly over the articular tubercle and cannot return easily. Third significance is arthritis, that is, degenerative or inflammatory changes that can cause severe TMJ pain or dysfunction. Fourth significance is referred pain, that is due to auriculotemporal nerve supply, and pain may radiate to the ear or temple. Conclusion of this lecture video. Temporomandibular joint is a unique synovial joint that allows a wide range of movements that are essential for chewing, speech, and swallowing. Its complex anatomy, including a fibrocartilaginous disc, multiple ligaments, and coordinated muscle action, ensures stability and mobility. Understanding its structure and function is critical in diagnosing and managing TMJ disorders, dental issues, and maxillofacial conditions. And this was all about temporomandibular joint. Hopefully you liked the video. If you do, don't forget to like, share, subscribe, and comment. Thank you for watching.